Britain is making extensive preparations for additional measures to tackle the coronavirus outbreak. Let's cross to our London correspondent, Hudson. A very good afternoon to you, Holly. We know over 300 cases of coronavirus reported in the United Kingdom. Take us through what's happening.
Yes, well, in comparison to what is happening in Italy and perhaps other European countries, Britain is taking a very calm and measured approach so far, a gradual phased approach. The government published its action plan against coronavirus last week and maintains that the country is still in the first phase of that plan, containment. Now, those phases were containment, delay, research and mitigate. Boris Johnson yesterday insisting that the country was still in the containment phase. However, it was all about putting the country on notice. There are going to be significant changes on the horizon, but the government says their approach is very much rooted in science. They're being led by the scientists, by the data. They're modelling the trajectory of the virus here and claim that at the moment it's very much a case of keep calm and carry on. They're urging business as usual, but also, as you say, they are preparing us for the fact that there are going to be significant changes coming, for example, in relation to self-isolation. At the moment, anybody returning from a coronavirus-hit country such as Italy is being asked to self-isolate. That may well be extended to people suffering just flu-like symptoms for a week. We know the worst-case scenario the government is planning for here is a fifth of the workforce off sick. They also say that they will, if necessary, close schools, deploy the army, as well as potentially locking down cities. They haven't ruled out a full-scale lockdown as Italy has done. But in terms of the medical rationale for things, for measures such as that, for such aggressive containment and draconian measures, the British government seemingly not believing that there is one. We heard from the chief scientific advisor yesterday saying that in terms of social gatherings, of course, France have moved to ban gatherings over 1,000 people, as have many other European countries such as Romania. But at the moment, following meetings with sports authorities and broadcasters yesterday, the British government doesn't feel that it is necessary to, as yet, do so. So the government, though, being forced to defend it and sort of strengthen or reinstate its case for this sort of keep calm and carry on message, because of course it is facing now criticism in the wake of what is happening in Italy, that not enough is being done, that now is the time to act to prevent an outbreak and a spread on the scale that we have seen in Italy.
Holly, I'm glad you brought up the issue of keep calm and carry on. In South Africa, our Minister of Health, Dr. William Kize, has been imploring people to keep calm and also warning against the spread of fake news. I see the NHS is working with not only Twitter, but other social media corporations to ensure that when someone searches for coronavirus in England, the NHS information is the one that comes up. Talk us through how information is being distributed there, fake news, and the attitude of people who are receiving that kind of news.
Yes, there is a big campaign by the NHS. They have made changes today. In fact, the Health Secretary announcing that they are making sure, as you say, that any searches bring up World Health Organization advice and that people don't end up finding the wrong information. There are fake accounts online, even hospitals, fake accounts that are pretending to be hospitals and giving out wrong medical advice. So that is something that the government here and the Health Minister are very keen to avoid, to try and sort of allay these concerns, stop people from panicking. We heard the Prime Minister yesterday urging people to be responsible, because despite this keep calm and carry on message, of course, people are watching open-mouthed at a country nearby in Europe that has locked down its entire population, and that has already served to cause some panic here. We've seen shelves emptied in supermarkets of everything from tin foods to toilet rolls. Certain supermarkets have began limiting items. The government, of course, have advised against stockpiling, saying it's absolutely not necessary. However, they have now met with retailers and they will be extending times in which deliveries can be made in order to basically ensure that when the time comes that there is going to be an upswing of cases here, and the government are pretty clear on that message that there is going to be a peak. They just want to delay it to a point where the NHS are better prepared to cope with an influx of cases, with a strain on its services in the summer months. Of course, we're coming to the tail end of winter here, where there's several more cases of flu, for example. The NHS, the Chief Medical Officer and Chief Scientific Advisor here say will be better be able to cope in the summer. But they are, of course, this is all about timing. They say they don't want to strike at the wrong time and trigger such extreme social distancing or containment measures at a time when people might end up getting fatigued at exactly the point when they shouldn't be doing so, when it would actually work. So there's been a real sort of difference in approach by European countries around the world, and it's very clear to sort of see that when you compare the British response perhaps to, say, the response so far across the EU.
Holly Hudson, our correspondent in London, giving us an update on coronavirus.